Well, RSV is a really common virus that's currently circulating at very high levels. The symptoms are similar to a cold, so you might have a child with runny nose, cough, wheeze, and a high temperature. The under 2 years are especially vulnerable to RSV infection, and we are seeing a lot of hospital admissions of the under 2s at the moment with RSV. So we really would urge people that if they have a very young or a very vulnerable child at home, that it might be helpful to cocoon them over this Christmas season. So just limiting the visitors to the house and limiting the visits that they make. Well, influenza virus is currently circulating at very high levels, and we do expect this to increase even further and to peak in the coming weeks. So this would be very typical of this time of year. So in order to prevent this, we're really advising people to avail of the vaccines. We know that children are twice as likely to catch and to spread the flu, and younger children in particular are very vulnerable to becoming very unwell with the flu. So by vaccinating a child, you're actually protecting them and you're protecting all of those around them who may be vulnerable. If you are unfortunate enough to pick up one of these winter viruses at Christmas time, we would advise you first of all to stay home and limit your contact with other people as much as possible. We would also advise you to drink plenty of fluids, stay hydrated, take paracetamol where needed, and just to rest. But it's important to say here that these are viruses, so unfortunately they do not respond to antibiotic treatment. So in general, the advice would be to stay at home for the duration of the illness.